Hi, this is Dr. Donald Pelto. Here you can see a patient that actually has a callus on the bottom of the foot, and in the center of the callus there's a little black dot, and that's what we're concerned about, having a ulcer down there. And we're going to be showing you the picture next after we debride it and how we're treating it. Hi, this is Dr. Donald Pelto. I have a patient here, and I just took a picture, and you saw before where there was a lot of callus tissue on the top, and there was a black area in the center. And as you can see, there's a little bit of an area in the center, and it doesn't look like a problem. It's a callus, but what happened is there was a big callus on the bottom, and then the central portion, since there was more pressure in the center portion, it developed a little bit of an ulcer or a pre-ulcerative lesion. And that's something important. This is a patient that I've been seeing pretty much every 3 months for a long time, and we may need to increase the frequency of the visits to every 9 weeks to prevent this from happening. So I trimmed down the callus today, and you can see it's not a big wound. It's actually just a little bit of blood right in the center. But this is something that we want to prevent from happening. So frequent visits to trim down the skin is going to be the best way of dealing with that for this patient. Now, once again, just explaining why this happens a little bit. When this patient walks, there's not as much movement in this big toe joint right here on the side. Since there's not as much movement in this toe joint, the movement can only come from up here or down here. And so in this patient's case, she gets the movement from this joint, and that causes that callus to form that needs to be trimmed down every so often.